Some contributors to stress and burnout. What we're really talking about here is like in a misalignment, either in your beliefs, your values, even like your physical capabilities. So a list would be the heavy workload that we have as nurses, um, the moral distress of maybe having to deal with the treatment plans that might not go along with what we believe is right. Um, Conflict with other healthcare professionals, nurses, doctors, um, and that kind of touches on the lateral violence, conflict with or caring for patients with terminal illness and death. That takes its toll on us. Physical and psychological environment stressors such as staff shortages, which you can all relate to, the time constraints, to charting, and the long hours, and it affects our bodies. And then when we leave the hospital, we're to have to balance work, life, personal duties, and it affects those relationships. Um, Another aspect is how burnout and stress impacts the nurses at a high level cognitive way. And these high level functioning aspects are essential to the safety of the patients. Studies have shown that there's more med errors, failure to recognize life threatening signs and symptoms, and impacts nurses' personal life, which leads to depression, reduce job satisfaction, psychological, and it disrupts their personal relationships.